Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome, everybody, to a bonus episode of A Tale of Two Hygienists. This episode is part of a special series we're doing in conjunction with Cellerant Consulting Group and their Best of Class Hygiene Award winners. If you're not familiar with this, here's just a little bit of background. Since 2009, there has been a special committee of clinicians that would evaluate as many products and technologies as they could. And the best of the best would be winners of an annual award called the Cellerant Best of Class Technology Award. Now, these clinicians, they were not compensated for their efforts in this evaluation process, which is a really important point because it led to an unbiased, nonprofit, and kind of a transparent process. So realizing, though, that the everyday dental hygienist could also benefit from such a model, Dr. Lou Schumann developed an additional branch for hygiene. So for this special series, our plan is to highlight one winner each episode and dig a little bit deeper into why they won the award. And we'll start this series off with a favorite of the podcast, Perio Protect. We welcomed in Tanya Dunlap at RDH Under One Roof at the Cellerant booth as we talk a little bit more about Perio Protect and their non-invasive perio trays. I know you're going to enjoy this episode. So here's your inside look.
A tale of two hygienists.
All right, everyone, I am so excited to bring on Tanya today. So if you've been listening to the podcast, you know that I love Perio Protect. You guys have heard the ads, you've heard this special interview we did with Liz. We've got great feedback, Tanya, on those episodes. This is an exciting time for hygienists. But one thing that we didn't really cover that I think that we probably should have or even could have is more about Perio Protect, the company, more about the background. I know we're going to talk about a little bit about like the pandemic and what that has taught us. So if it's okay with you, I just want to turn the time to you and just run with it.
All right. Well, I just first say thank you. I'm so happy to be here with you guys. It's always a privilege. And just to be sitting here talking to you is also special because normally we do this over the internet.
That's right.
But I do appreciate your kind words about Perio Protect, the fact that you stand behind it because you've seen it in clinical practice.
Absolutely.
And this is what the company stands for. So Perio Protect started with a dentist really trying to treat his patients. And it goes back a couple of decades, but it was his mother. And she, he was trained in periodontics. He almost specialized, but he ended up doing TMJ instead. So he saw her, she needed surgery. This is pre-laser days, really way back, and sent her out for a quad of surgery. And she came back and he said, "Mom, you look great. Let's go. We're ready for the next one." She said, "Oh no, we are not ready. I'm not doing it. I will lose my teeth before I do that." He didn't want to see his mother lose her teeth, right? I mean, that's just a slippery slope. And so she said, "I'll do anything you want. I will try anything you want that's non-surgical." And so he took her up on it. And the first thing he tried, being conventionally trained, the etiology of periodontal disease, the root cause is bacteria. Everybody was trained back in the day that you use antibiotics for bacterial infections. So he tried injecting antibiotics. They just flowed right out. He had a tufted floss that had a lot of promise. This floss, every couple of inches, there was some tufting, and it was soaking in antibiotics.
Nice.
And it worked, but not uniformly. It technique sensitive. It didn't really get deep enough. It was messy. You flicked antibiotic all over the mirror and yourself, so it was hard to use. And in controlled clinical trials, it was just the technique sensitivity made it fell flat. So that was out. So then he started using a tray design. If you just do a regular vacuum form tray, the problem is it leaks all over. It really is just topical application and doesn't even hold it in place very well. So he played around with a bunch of different designs, and then he finally came up with a design that worked. And it has an internal peripheral seal. So on the edge of the tray, on the internal periphery, there's a seal. And the seal and the extension beyond it hold the medication not only in place, but it doesn't really have any other where to go except below the gums. And so it can drive the medication really deep. And in studies, they were showing how deep it could actually get with 8, 9, 10 millimeter pockets. Now, we're talking about adjunctive home care. It doesn't replace anything that you would normally need for those super deep pockets. But it was reliable. And so he tried it in his mom, and she got great results. He tried it in his patients, and they got great results. And then he took it to FDA, and it took quite a while to get it through FDA clearance. And so that clearance allowed him to take it to the general market. And so that happened in 2005. So Perio Protect was born out of that need to treat his own patients. And what he really cared, this doctor, what he really cared about was getting his own patients healthier and then taking it out. So the tray has clearance from FDA to deliver any drug, and that was done on purpose so that you could have some flexibility as a wet glove clinician, right? At the time, he was using an antibiotic. It was vibromycin and doxycycline calcium, because everyone has seen the studies about how doxy works well.
Right.
And he was using hydrogen peroxide. Now, the hydrogen peroxide was designed to be, in part, a propulsion agent to make sure you could get the antibiotic really deep.
To push it down there.
Right. That was before the tray design was so reliable. But so one of his patients came back one day, and she looked amazing. And he said, "Keep it up. You're doing great." And she said, "Do I need to get that liquid medication anymore?" And he was like, "What do you mean?" She said, "I ran out of that months ago. I've just been using that gel, which was the hydrogen peroxide." So this was like an aha moment for him, really startling. And he said, "Yes, we'll get you another prescription." But then he kind of went back into the literature to figure out, why was the hydrogen peroxide working? And this was at the same time that Bill Costerton was coming out with all of his amazing research on biofilm. This is before people even knew what biofilm was. Bill Costerton was one of the researchers who coined the term, this living film of bacteria. And it turns out that hydrogen peroxide works really well against biofilm, and it overcomes all kinds of obstacles that you have with antibiotics because as an antimicrobial agent, it works by breaking down protein chains. So essentially, a biofilm's covered in a really sticky goo. There's a lot of protein in there, so it can cut through the matrix, that sticky protective layer. Bacterial cell walls are a bunch of proteins linked together. It can cut through a bacterial cell wall and kill all kinds of bacteria, aerobic, anaerobic, facultative anaerobes. And very importantly, as hydrogen peroxide bubbles up, you can imagine this, right, in your mind. It's bubbling. Everybody knows what that looks like. It's releasing oxygen gas. And this is where it gets really important because the tray is sealed. It's not letting the oxygen out. You're building pressure inside the tray. Now, peroxide is going to break down to oxygen and water. Your body will eventually absorb both. But this was a really important discovery, the importance of oxygen therapy. So the oxygen changes the microenvironment of the periodontal pocket so that healthy bacteria repopulate at the expense of the pathogens. So that was just super important, right? And that was like the first discovery. And then came all of this new research on oral systemic links, right? Okay, we have been through a couple of years with this pandemic.
Yeah, I mean, it feels like longer than a couple of years.
Yeah.
But yeah, it's at the time of this recording, it's only been a couple of years. Everyone.
Right. So it's been difficult, and we're still getting past it, right? There's still some challenges. But the pandemic forced a lot of people to do a couple of things. One, reevaluate what's really important to you, and also look at your own health. Because what we learned in the pandemic is that a healthy immune system really matters. And when we are talking about dentistry, hygienists have a really key role here in patient health and wellness. And that is all about overcoming that low-grade chronic burden of periodontal disease. So we got concerns with cavities. I get it. There's all, broken teeth. There's been all kinds of stuff during the pandemic. But a lot of people skip their appointments, skip their regular maintenance, or they were never even diagnosed because they didn't show up. So what you can do in the dental office, you said it was a really exciting time for hygienists. It is a super exciting time, right?
Yeah.
So let's first say we're already in the post-antibiotic age. Antibiotics aren't working well. This message is becoming clear, but prescribing practices are really hard to change. In fact, before 2019, when we had pretty good records about this, there was almost no change in prescription rates. Dentists are the #1 outpatient prescribers of clindamycin. Clindamycin has this huge risk for C. diff infections, which can be fatal. So let's put all that in perspective and say the profession as a whole is looking at it and trying to prescribe less, having better antibiotic stewardship. And I applaud everybody for that. But you've got new options right? You've got, everybody, you've been using ultrasonics and so forth, but there's laser therapy, there's the new guided biofilm therapy, all these non-antibiotic options. You've got great in-office treatment. But what we're missing is that great home care, because it's cyclical, right? It comes back, the biofilm repopulate. You do a fantastic job with guided biofilm therapy, but it comes back. So that's where this prescription tray therapy comes in, Perio Protect. And that's why it's so important for hygienists especially to know about it and to let your patients know. Because if patients don't know, they can't make an informed decision. And that's, in my opinion, just really, really important. And Andrew, you know, because you're a coach. Hygienists, it's hard to be rejected when you make a treatment proposal and they say no, or it's insurance driven. That's hard on you as a person.
Yeah.
But if you can get beyond that and say, I'm doing this for the patient's benefit, right? I'm giving them the information that they need to make an informed choice. And I know that this can help them. And what we see when you use this tray therapy, it's just with hydrogen peroxide gel. There are other drugs, but we're talking about hydrogen peroxide now. When you use it just 10 to 15 minutes a day, you get substantial reductions in bleeding on probing, substantial reductions in inflammation. And all of that has a positive effect on your whole body health. And it really matters. So what you can do in the dental office, think about this. What you're really treating are chronic oral wounds. It's a chronic oral wound care center, your hygiene op is. And to think about it in that way and how important your role is, this is why we love to partner with hygienists, because the hygienists are on the front line. You often have a better relationship with the patient than the dentist does, right? And they trust you. And it's so important to do that. So
can we just, I'm sorry, I need you to repeat that one more time about this, like our operatories are chronic wound centers.
Yeah, so think about this.
You said it really fast,
Yeah.
and I'm telling you, this is important, everyone. If you're listening right now, you have to put the importance of that into your chair.
Yeah.
Because I think, honestly, Tanya, we still, as hygienists, I mean, we're scraping away.
Right.
We don't value what we do right next to our patients every day.
Right.
It's incredible.
And it's so important to value. So let's unpack that. What is periodontal disease? It's chronic infected tissue. You have lesions. You can't see them very readily. You can see the blood, right, if you're probing.
Right.
But you can't see them. And your patient definitely can't see them, right? They think they're bleeding because you poked them.
That's right.
So it's a chronic ulceration of the gingival tissue. That's a chronic oral wound.
Yeah.
And to consider what that does to the immune system. Okay, let's talk about diabetes because it's been the best investigated and best reported. It's a two-way street, right? If you have a type 2 diabetic, they're much more likely to have periodontal disease. And if they have periodontal disease, it's much harder for the body to regulate the blood sugar. So treat it like it's a battery, right? You've got two things hooked up to this battery. You've got type 2 diabetes, which is an inflammatory-driven disease, and you have periodontal disease, which is an inflammatory-driven disease. It might be low grade, but it is constant. If you can unplug periodontal disease from the battery, your body can focus much more succinctly, efficiently on helping control the blood sugar.
Absolutely.
So think about that in terms of what the value you bring to patient health and wellness in just telling them, right? Just educating them. And then if you can empower them with better home care, you cannot go home. You can't go home with them. They can't come in every week. Now, I know periodontists who have patients come in every 8 weeks. But I truly believe that they would get better results if they would implement Perio Protect, right?
Yeah, absolutely.
And you've seen results in your offices.
We've seen amazing results. We actually just had a meeting with all of our operations leaders, and we asked the question. I think there's about 35 of them. All right, we've talked to your clinicians already. We ask them every time that we're in the offices, what are the results? And everyone always tells us, oh, that's fantastic. But that's what we want to hear, right? So sometimes we're thinking maybe that's not true. But we asked all of the office managers, okay, when our backs are turned, when we walk out, what are your clinicians really saying about it? And they're like, Andrew, hands down, like this is the most amazing thing. We have our patients who haven't been able to get healthy for years and years of us treating them. But it goes back to what you said. We are there doing a great job in the clinics. We have amazing clinicians.
Right.
But that home care part, like, we can't help regulate that without it. So it's been amazing.
And for years, we blame patients.
Yeah.
But honestly, what are they going to do? But most people brush. They might have bad technique, but we've got all kinds of power toothbrushes to help overcome that. Most people don't floss. Even if they did, though, even if they had great technique, it doesn't get deep enough. Rinses don't get deep enough.
Yeah.
So that's why the tray is so important. The tray is just a delivery device. It's not really doing the work. It's the medication that's doing the work. But it gets the medication down there and holds it there long enough. So what we like to challenge hygienists to do is to tell us how much bleeding is acceptable in your practice. And I don't mean that in an affront. I mean respectfully, I don't think you can get everybody to 0. But what's your goal?
Yeah.
And at what point do you say this is totally unacceptable? Because I'm saying right now, the incident of periodontal disease we have in the United States is totally unacceptable.
Absolutely.
Right? 47% of American adults, young American adults over the age of 30, but by the time you get to 65, it's like 70%. If antibiotics were going to work well, they would have. Let's quit.
Would have already, yeah.
Right. They would have worked well already. We've been using them for decades.
Yeah.
So let's move beyond that, and let's empower them. These awesome new options in the office, let's empower them at home also. So pick your number. What is it? I have talked to thousands of hygienists about this.
What do you hear most often?
10. So we got a few that say 0. Knock yourself out.
Good for them.
Right, exactly.
Fantastic.
Right. Some say like 2 per quad. So that's a way to think about it. So 8
like
is their
that.
number, yeah. Others have 15, and the highest I've heard is 20. And some people do percentages, but unless you have software like Florida Probe, which is an awesome software that automatically calculates it for you, I think the number of points is better.
Sure.
But 10 there's a general consensus. You get 10 or more, you really need to be impressing upon them the importance. And then if you know your number, how that helps the office is if you've prescribed it in the back and they come up to the front and they can say, why do I really need this, right? I don't totally understand. And you've told them a lot of information in the back. That's a lot to absorb as a patient.
Yeah, it is.
And it's easy to forget these things. So you walk to the front, and the easiest answer in the front is, we recommend Perio Protect because you have an active infection. And it's important to us that we treat an active infection.
Absolutely.
That's the answer. And that's really the bottom line. What you are after is better health.
I would also like, if I could just add to this, when we're looking at bleeding points, clinicians are generally trying to be very light with the probing, I feel like we don't necessarily get the most accurate bleeding points from a probing. So what I would encourage hygienists to look at is, if you go in and you do your perio charting, you're only having maybe 2 sites per quad like we talked about. But then you get in and you start scaling, just hand scaling, not instrumentation yet. And it's a bloody mess.
Yeah.
You have to understand that ulcerative tissue down there was not being, I guess, engaged by the tip of the probe at the time that you did the perio charting.
Right.
And further, if you have really deep pockets and that ulceration's way down deep, it might not, by the time you moved on from that spot, migrated its way, through the, to where you can see it. So if you're having more bleeding points when you're doing your hand instrumentation, I would count that as well.
Okay. And another time to think about this is, if your office does a lot of restorative work or a lot of cosmetic work, either way, you are going to get optimal results when you add this home care. So cosmetically, hydrogen peroxide, it's a low-grade peroxide. It's 1.7%. It helps maintain whatever cosmetics you've done in office without any eating or drinking restrictions. So everybody likes that. But restoratively, think about crown margins or implant margins, right? Our restorations have a shelf life. Crowns especially. Let's talk about crowns, right? And this is my favorite question to ask an audience, because you get wildly different answers, right? Some people will tell you crown's supposed to last 8 years. Other people will tell you 20. But whatever your number is, it's not going to last as long if you've got an infection around the margin.
That's right.
And so if you can clean up that infection, you can prolong the life of their restorations, and just think about what kind of value that is for patients, right? And the values are important, and we want to put it into a kind of preventative mindset. So if you have gingivitis, what we want to tell patients is, our goal with perio tray therapy is to get your gums so healthy that you don't lose any bone, become a periodontal patient, and have to come in every 3 months. I don't think most patients know.
Yeah.
If you get diagnosed with periodontitis, you're going from 6 to 3 months. Or if they're already a maintenance patient. This is another good question for an audience. How often do you think people need to have scaling repeated, right? So there's a general consensus from my responses that it's every 3 years. It's going to vary based on their severity. But let's say it's stage 2, right?
Sure.
Most people say every 3 years. So you got a maintenance patient. Our goal with Perio Tray therapy is to get your gums so healthy that you don't need another round of scaling right away. Ideally, you'd be able to prevent it forever, and you don't want to promise that. But that would be your goal, to get them so healthy and keep them, because these are long-term results, right? Or let's say they're stage 3, and maybe they even need surgery. Or our goal with Perio Tray therapy is to get your gums so healthy that you're not going to lose any more teeth.
I love it.
It's all about what's best for the patient.
I love this so much. You know I do. And thank you so much. By the way, congratulations. I mentioned it on the intro, but congratulations on winning the award.
It's such
so
an
well
honor.
deserved.
Thank you. It is such an honor to win this award. We feel really recognized for the work that's been done, and I would love to share it with all the hygienists who are offering Perio Protect to their patients, because really, you all are the backbone of why patients are getting healthier.
It's just like you. You're so generous. If someone is listening to this and they want to reach out to find out more, where is the best place for them to go?
So if you want to call, the phone number is 314-256-0772. Online, we recommend Providers with an S on the end of it, providers.perioprotect.com. But if you have a general question or you just want more information, you can email, and that is support@perioprotect.com.
Wonderful. Thank you so much for being on.
Thank you. I'm so glad to be here with you.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.